Today, every day, small cap investors visit Agoracom knowing this is the day to discover the world's next great company, to have their dreams come true. That's why I take to the open road, to find them, to tell their stories, to engage them, to bring them to life, because they want to connect with you from your office, your phone, your home, anywhere. Agoracom, find your dream. Welcome to Beyond the Press Release, a production of Agoracom, in which we take the time to speak with small cap CEOs right after they put out important news. And today was a big one. We're happy to have him back. Steve McAuley, he's CEO of Empower Clinics. The company trades on the CSE under the stock symbol CBDT. For our friends in the US, on the OTCQB under EPWCF, and for our friends in Europe on Frankfurt under 8EC. Now, for those of you new to the story, that's going to be a lot of you, because most of you people are tuning in because the company closed up 76.9% today on over 25 million shares, and the company's got a ton of interest. But this is what you should know before we go into the interview. Empower is a vertically integrated CBD life sciences company, essentially with a they're a multi-state operator of medical health and wellness clinics. Some of the numbers behind the company are great. 165,000 patients in their database. Patient visit growth to their clinics, Q4 was up 351%. Q1 2020 was up 478%. Clinical revenues are up 130% for Q3, up 188% in January. Bottom line is they're hitting it out of the park. But the big news today that led to this massive move in the market, and I'm going to read the headline: Empower Clinics commences coronavirus COVID-19 antibody testing and establishes national rollout plan, signing supply agreements for rapid COVID-19. Steve, welcome back to the show.
Thank you, George. Always good to be on with you. We've got a lot to talk about today.
Yeah, a lot. I mean, we just had you on April the 14th, with great news, some great things going on there. This came out of nowhere, but congratulations, first of all. You're the overnight 16-month success story, because you took over this company 16 months ago under some pretty precarious circumstances. Before we get into the details of this press release, how do you guys feel over Empower today?
We feel great. I mean, it's wonderful to have, a market response like we saw today. I anticipated that it had the potential to be strong, but, seeing that kind of liquidity go through, that's never before in the history of the company have we traded, in excess of 20 million shares in a day. I think we've had times when I've been able to get it to run to, 5 million shares in a day, but this is kind of next level. And what's nice is that we actually got, very strong lift in price that the markets haven't seen, certainly not in the medical cannabis space or, the cannabis industry overall of late. So I've been really working hard to try to separate us, to have people out there in the investment community recognize that we're here and that there's maybe some unique characteristics about what we're doing that you want to follow and be part of.
Well, for a long time, you were almost the boring story. Clinics, people walking in, physicians, these meetings, appointments going on, prescriptions. Sounds like that's not sexy enough. But as everybody else's business plans, not everybody, most business plans were falling apart because they weren't executing. You, who, by the way, for everyone at home, probably doesn't know this, you, a Six Sigma certified CEO under Jack Welch back at General Electric, you just moved this along methodically and have built a fantastic business before we even got to today. So let's talk about today, because this takes you potentially to a whole new level. First thing, antibody testing. We all hear a lot about that. We're not going to get down in the science of it today, but in layman's terms, because we've all heard it, but I don't think we all understand what it means. What is antibody testing that made you go this route?
So people are probably been familiar, as we see it on the news over the last few months, of these swab-based tests. So they call them a PCR test, and can either be a throat swab or a nasal swab. They are kind of fraught with the potential of false positives is a lot of moving parts because it goes from person taking the swab to lab, and then lab technicians have to work with it. So, and it's not as scalable as is required because mass testing is ultimately required in our society. The next type of test is a blood-based test, and it can be done as a blood draw that we happen through our clinics every day, or it's a finger prick test to get a blood drop, somewhat similar to what you would do if you were a diabetic patient. So it is looking for antibodies. The test itself is called a colloidal gold-based test that is identifying antibodies in your blood, and therefore, if you have those antibodies present, which one is these proteins present, one called IMG and one called IgG, then you have either actively have COVID-19 or you've had it recovered and you have antibodies. And so these new tests are using blood to identify the result. And there's a new version on the market that we're bringing to market here, in the US right now, which is called the rapid COVID-19 test.
And for everyone at home, stay tuned. A little bit of foreshadowing. You're actually going to see the test on screen for the first time. I've saw it pre-taping, and it's amazing. Let's go into the business side of this. Look, Steve, you're incredibly qualified, more than anybody probably in the small cap space, to deploy something of this magnitude efficiently, professionally, and economically viably at the end of the day. But it is a brand new business, is it not? So what do you know about the profitability, about its viability that will actually benefit the company in the long run? Because how much do we know about the economics of something like this?
Sure. So let's preface this by saying this is not a brand new business. We are not a brand new business. We are operational. I've got 75 employees, physicians, administrators, management staff, clinic assets, telemedicine platform, and great technology layer. So the business is not new. What we're doing is we're leveraging our assets and we're adding an additional service offering and an additional product that goes along with it, right? Very distinctly different characterization. So, the economics are straightforward. We are buying through supply agreements access to these rapid test kits. We are deploying the test using initially our personnel, so our clinic staff in our clinics, and also on a drive-up basis. And we'll talk more about how these phases play out. And so we are then marking up the service and the product and making it available to the public. So we have to account for our cost of goods sold. We have to account for labor, PPE, profitability or gross margin. And then we come up with a pricing offer that we take to market that we feel is fair, it's competitive, and still sustainable, and still makes sense economically for us as a public company.
And fair may be the keyest word of all those in there, because you want to make sure, you're nowhere close to even the appearance of price gouging. So you want to charge a fair price that's going to, that's going to be determined by demand without going overboard. But let's talk about the phases, because each one of those, first of all, I love the fact, because we've seen some companies, I don't want to harp on that, but we've seen some companies kind of delve into this in their press releases. And I think some of them are doing it just to try and ride this wave, right? They don't all look that authentic. What I love about what you've done here is you broke it down to these 4 phases, which tells me you clearly have it already laid out. You're not saying, yeah, George, we're bringing them in and we're going to be testing people. But they all have very different profitability looks like. So let's go through them. Phase 1, right, is going to be in clinic. People get tested in your clinic. You send the results out and they come back in 48 hours. Phase 2, and we'll just go through phase 1, 2 first. That's in clinic, but you drive up and you get your results in 15 minutes. So just those 2 models are very different, because you have to send them out to another lab. That's an added expense. In the second phase, you actually talk to me about the economics of each of those and how that changes your pricing. Will your pricing be changing?
Yeah, so the short answer is it will. So the economics are different. So phase one, and again, it was crucially important for me to ensure that, we know that we can walk before we run. The big mistake that we would make is saying that we can do too much and we underdeliver. And I don't want to underdeliver to our employees or to patients. I don't want to underdeliver, overpromise and underdeliver to the market. So I needed to make sure that we had a structured rollout plan so that we can learn along the way before we jump into this concept of nationwide rollout and what that actually entails.
Which I give you credit for, by the way, because a lot of my experience, a lot of small cap companies would fall right into that temptation and just want to go big right off the bat, rather than having the patience to roll out, learn, roll out, learn, roll out.
Yeah, I mean, what was most important, what was important for me in how we've announced this and even the timing of it was I was not prepared, and I would not allow our team to get ahead of ourselves. Meaning, I did not want to put out a press release for the sake of putting out a press release, such as, hey, we're thinking about working on a COVID-19 program, and maybe it never materializes.
Yeah.
So we've been working on this with urgency because it's an urgent societal matter. And I believe that we're as equipped as any group to be able to deploy this.
Yeah.
So to me, we had to come up with a solution. We were negotiating these supply agreements for the rapid COVID-19 test kits over the last period of time. But what we had already developed is a working relationship with a lab that we currently use for other types of laboratory services. This lab is one of the FDA approved labs for COVID-19 testing, and they've submitted their lab processes, so they are authorized for use under the Emergency Use Act. So it's a valid lab, high quality. We know them and they know us. So phase one for us was, how do we use our clinics, our physicians, our clinicians, and our locations to start a pilot in our Phoenix market, where we have a concentration of staff and clinic operations. So the first one is a blood draw. You need a physician's recommendation or referral to initiate a blood draw. And so this is a patient would register, book their appointment. They will come in and they will see one of our clinicians who will draw a sample of blood that will be stored.
And this can be a vial, right? Not a pinprick. We're talking vial.
It's going to be a vial of blood that will be packaged up correctly and then sent to our laboratory for the actual COVID-19 antibody test that they will be running. Their results come back usually somewhere between 24 and 48 hours. The results will be shared with the patient, and they'll be shared back with us for tracking, because we're tracking all of this data also. So that's phase one for us. Phase one has two components. You may elect as a patient to come to our clinic location, or you may choose not to. Either you don't want to, or you're not able. In that particular case, we will dispatch the clinical worker to go to your doorstep to do the blood draw. And we call it doorstep because we don't want to enter people's homes. The clinicians will have full PPE, whether it's in clinic or on the doorstep, but the result is the same. You're able to register with us, get your appointment, pay for the appointment and test, and get your COVID-19 results.
And the great thing about doorstep in a place like Arizona is you can go doorstep pretty much year round, as opposed to doing it in Toronto where I am. So I like that.
Yeah.
Phase two seems, that's the one that we've all seen on TV. Basically, we've watched South Korea drive up, someone gets a test right there, they get the results in 1 to 15 minutes. I mean, that's going to be a much bigger, phase one is great because you're going to learn small steps. Phase two is where it accelerates. So how difficult is that going to be? Because I'm expecting to see cars lined up as far as the eye can see, just like we see in South Korea. You guys are ready for that?
Yeah, so we're getting ourselves ready. So so phase 2 is utilizing the rapid COVID-19 antibody test. And so I have a preliminary shipment that's arriving later this week to our clinics in Arizona for that first initial run. We will probably start opening up to taking appointments within the next couple of days, only because I know where the supply is coming from. We'll be placing an additional larger order of kits for a next wave of pilot program toward the end of this coming week. And I've got about a 7 to 10 day lead time from manufacturer to landing at our doorstep ready for operation. 2 styles in this approach as well. One is drive up. So instead of going into our clinic, you simply will drive up. We are working on the logistics of the parking lots. We're working with our landlords for traffic control. You would simply drive up and stay in your car. A clinician will come to you. You have your appointment, you have your reference number, you identify yourself. We fill in the additional paperwork, and the test is administered. Results anywhere from 1 to 15 minutes. We will document the result, give the documentation to you so you know exactly what your status is, and then you would go ahead and leave. We expect that families will drive up together.
That's going to be the one that really breaks out the volume, right? That's going to be the mass one right there.
Well, I mean, I think there's more mass volume coming in other phases, but this next phase,
that's the beginning of it, right?
Of the drive up. What we also will do as part of phase 2 is drive to your doorstep. So we are creating a model right now using a network, again, of our clinicians. They have to be our clinicians. They have to be trained by us. And we're hiring staff for this right now. And they will each day have their list of appointments in a particular geography. And they would then go to the doorstep of the patient who's purchased the test and selected an appointment, and conduct the test on the doorstep, fill out the paperwork and results in the exact same way as if they come to our drive-up version.
Now you've got, this is the fun part for me. You've actually got a rapid COVID-19 antibody test kit with you right now. You used it for your own test that you did on Facebook, but still, let's see some of those components so everyone get an idea. Everyone at home get an idea of, generally speaking, what it's going to look like.
Yeah, so I'll give you this packet is open, as you can see. So this was a sample kit that was sent to me last week by one of our manufacturers. It's sealed and sterile environment while it's shipped. Inside, you'll have an alcohol swab in a packet. There'll be, mine's contaminated, so I won't show those to you now. But the main things that you have are, this is the actual COVID-19 antibody.
Look at that. Look, that's the first time. I mean, I saw it a couple minutes ago. That's probably the first time most people are seeing at home. And what we're seeing, Steve, I can say it, is in the bottom, that red droplet, that's your blood. Right?
Yes, this test, this is a contaminated one because it's mine and it's been utilized. So if you want to see what the testing procedure looks like, you can go to my Facebook page from a few days ago, and I shot a video of me conducting the test and then announcing my results, which are negative. And
which, by the way, shows there because they're negative. So I see a line, and there are three choices: C, IgG, IgM. You've got the line at C. What is?
So what happens? So the test itself is going to provide you with one of 3 results. One, you're negative. You simply have not contracted the virus in any form. 2, you are showing the proteins in your blood, indicating that the virus is there. So meaning active. And then
so
3,
infected.
You're showing an additional protein, which is actually indicates there's an antibody in your system. And so what that is indicating to you is that you previously did contract the virus, but now you have the indicators of an antibody. And in theory, we're going to, that should mean that you shouldn't be able to get the virus again in the future, but there's more science on that. But at least it tells you your immunity status and for your own, purposes, for your families, and then, as we get into phase 3, the importance of the economy and getting back to work. So in a simple, procedure, what happens is I take a blood draw. So included in our kit is a little small lancet. So it comes with a cap on it. And inside there's a little tiny fine gauge little blade. It works the same way that a diabetic pinprick on your finger would work. I've got the cover on right now, but without the cover, you would depress that on your fingertip. It's painless. It makes a tiny little pinprick, initiates a little bit of blood. And then there's a dropper that you take that blood sample into, and that is then put into the little small area at the bottom, followed by inserting 2 drops of an activator liquid, which has now been utilized in my test kit, so I can't show it to you. And then you wait.
How long did it take for your result to come back? Because it's between 1 and 15 minutes. How long did yours take?
It took slightly less than 2 minutes.
Were you nervous? By the way, side note, were you nervous? And which one were you hoping for? Were you hoping for the all clear, or were you hoping for you've had it and now you've got the antibody? Because I might think I might want you might want the antibody. I think, I'm happy that, it's negative. I mean, I was traveling, extensively in the United States, and as this was all coming about, and our get back home order, sort of came up. So I came back up home. I actually drove back, didn't take a flight. But then I went into the self-imposed 14-day quarantine. And we've really just been isolated to family since that point in time. We're practicing extensive social distancing. We're practicing extensive use of hand washing and using hand sanitizer sprays, and really just increasing our awareness of general hygiene on surfaces. And, frankly, we're very, careful with our kids and family about visits and things like that right now. But the most important thing of showing that demo, by the way, the all clear health is fantastic, of course,
Yeah.
But Fervent at Home, the most important thing is it's really doable. It's not some really complicated test that if you had to do it on your own at home, if you ordered it, you wouldn't be able to do. I think most of us would be able to pull that off. So putting that into a way that we can all see it and understand it is great, Steve.
Yeah, but I think so. I want to also be clear about something though. This is not the home-based test that we're seeing a lot of rhetoric on different news stations or national news programs in the U.S. and a bit in Canada. So don't necessarily compare this test to what they're talking about and assume that's the exact same thing, because it's not. What this provides is scalability. You can see that the materials of the test kit are plastic in design. They're light, they're inexpensive, and they can be mass made by these manufacturing plants. And I believe the private sector has to play a huge role in getting these tests to market, because as we go towards our phase 3, and my phase 3 version is what I'm kind of coining as the Business Employee Testing Program, or BET for short, we have to get this economy back to work. But how is an employer or an institution or a care home going to have the confidence to bring their base of people back together in more confined spaces? Well, there's only one way, and that is testing for the entire employee base. And on top of that, regular testing. So we have already created a subscription program for businesses.
Yeah, so Fervent at Home, by the way, phase 3 is the business program where they're offering the rapid COVID-19 test to businesses on either one-time, repeat, subscription, right? And as most of you at home would probably guess, that's going to be in big demand.
It is. And, there's operational efficiency to it as well. When you think about the operational programs of phase 1 and phase 2, there's some logistics there that have to be, created and managed. And we're great at operations. So I'm very comfortable with that aspect of the delivery of this service.
Sure. Six Sigma CEO.
Yeah, the efficiency of the business program is I can deploy one of my clinicians to a place of business. We set up a testing station, whatever that might look like in an office somewhere, and we can have an entire employee base. It could be 5 people to 1,000 people. We just deploy more clinicians. As long as we have an ample supply of the test kits, then we can deploy multiple trained clinicians to conduct tests, capture the data, and report that back to the administration and HR of the business or the facility or the institution or the care home.
And phase 3 is my favorite one from a business point of view as a shareholder, because that's the one that has the most scale. It's like you said, you can deploy George to go to ABC Widgets, and George can theoretically test, I'm not sure what the numbers are, but multiple people, 50, 100, 25, 50, 100 people, then say, okay, George, after ABC Widgets, go to XYZ Technologies. And businesses will, I'm not sure if you're going to be asking, but will probably pay a premium, right? They'll probably pay a premium for
and I don't necessarily know whether there's a premium to be had here or not. I don't even know if that's even necessary. What the business side of it, altruistically, I want to be an active participant in helping our economy get back to work. No one wants to see what's happening in our economy globally, never mind, in our neighborhood right now. So I'm as motivated as anyone to assist to get that back. We just happen to have a program and assets and operational know-how to help. We won't be the ultimate solution, but we certainly will be one of the contributing solutions to getting this done. And what I like about it is we have the manpower know-how and technology to scale this up. And from a business standpoint, it also makes good business sense because we've done a really nice job in getting these supply agreements in place with FDA approved manufacturers, because again, no shortcuts here. We have to.
This isn't George, Bob, and Mary saying, let's buy a bunch of these on Alibaba and start pricking people's fingers all over the place. There's a real professional, almost military grade rollout here to how this is going to happen.
Well, there is. I mean, I was not prepared to sign a supply agreement with a manufacturer unless I had all of their data. I mean, I've got the material that they've submitted to the FDA. We've done due diligence. We've seen their we know what their registration dates are on submissions with the FDA. We know what their FDA tracking numbers are for the FDA approval work that gets done. So appropriate due diligence has been done. We know the manufacturers are the big guys. Our one manufacturer called LiveZon is endorsed by the World Health Organization for the rapid COVID-19 rapid tests. These are the most legitimate manufacturers that we're utilizing.
Now, this is where I want to play devil's advocate too, because look, I love this press release, and I love the way you've done things. So I have a high degree of confidence that you're going to be able to execute everything that's in your control. But I'm going to play devil's advocate here.
Sure.
One, you're right. They are one of the most well-recognized, well-respected manufacturers out there. Devil's advocate, doesn't that potentially cause a problem for you though? Because everyone's going to be calling on them, and there are 1,000 Steve McAuleys in countries all over the world that are going to want it. And does that potentially lead to you getting choked out of supply?
So, I mean, I think there is some sort of volume risk related to that. I can tell you that with the one manufacturer, the distributor that we work with have the distribution rights for the United States and Canada. So the manufacturer is not going to be going into the market and trying to service the market themselves. They're serving it through distribution.
All right. So they can't suddenly get a call from George who sees this press release, says, hey, I want to order 100,000 of these and I'll pay 10% more than Empower Clinics. So that was my concern. The flip side, it's that you may be a victim of your own success.
Yeah, and certainly, and that's perhaps is a possibility. I think for us, Empower Clinics, the public company, I mean, these manufacturers are making literally hundreds of thousands of these kits per day. So we're talking millions of kits per month.
More than you could test, even if you had everything in control for now anyways.
Yeah, we as an entity don't have the ability to deal with 1 million tests in a month. I mean that if we did at some point, then that would be spectacular. But I'm ambitious, but then there's the potential of ridiculous. So we take our steps. I would like to think that we will absolutely be doing hundreds of thousands of tests in the very near future.
I'm glad you said that, because I was about to ask you, do you have a sense of your capacity? I know you can't make a projection or prediction, but we're talking 1,000 a day, or maybe, or 10, 20,000, 50,000 a day, or what?
Yeah. So, right now in our phase 1, which is pilot, we've ran capacity models in our clinics, because you have to remember that we have our other services, right? And so what we're doing is we're looking at hours of operation where we don't have crossover, and we're opening up earlier, we're staying open later, and we're utilizing weekends in different ways, so that our capacities of existing services that we provide to our patients continue without disruption. We do believe that our database of 165,000 patients are going to be COVID-19 test candidates.
Hey, my family got that email from you today, and I don't live in Arizona. If my family got that email from you, the first thing my wife would say is, hey, look, we can go to Empower Clinics and we can get tested. How fast can we get there?
Yeah, exactly. Like,
That's
get the
exactly
appointment.
what's going to happen.
Get the appointment right now. Get in the queue and let's go. So we know that. I mean, this is day 1 of go live, and I can confirm for you, we did COVID-19 tests today.
Okay, that's a new one. I didn't know about that. So,
so
just more testing though, more like beta testing to make sure you got the process down, or you're starting that first gear, second gear wind up.
These are not internal mock runs or things like that. This is literally external patients heard about it, came to us through the call center. The call center directed them to the website. They filled in the form, selected their appointment, paid their $250 for phase 1 testing, and they've got their appointment. It's done. Side
note, and because I want to hop onto a couple of other potential pitfalls, I want to make sure investors, because I can feel them almost asking, but that $250 for the phase 1 is probably a lot more expensive, because you got to send that to a lab and get a result back, as opposed to doing it on the spot with a rapid test.
Yeah, correct. So you've got more costs associated with it, because we have a phlebotomist who actually does the blood draw. We have the physician, and you require a physician's consultation in order to initiate the blood draw. We have the third-party lab that we have to send the sample to, have them run the test, and have them give back the test results.
So it's a clunkier process, more expensive for sure.
Yeah, so it's a little bit more clunky, not terrible. And
not, by the way, not because it's your fault, but just when you draw blood, these are the things you have to do. That's unless you're doing it as behind an alley somewhere. Where
and you have to keep in mind too that we have to operate within HIPAA compliance in the United States. We need to make sure that we're in compliance with any medical board requirements in a particular state. And again, I'm just not going to get sideways on these details because it's just not an appropriate way to run things. If we're going to do something, we will do it to the letter of the law. We'll do it correctly. We'll abide by the rules. But we have a product and a service that's in market right now in our clinic.
But that's exciting that you've already started phase 1.
Yeah.
A couple of other pitfalls I want to ask you. Isn't the government competition at the end of the day? I mean, we watch the president and his advisors have the daily conferences. We see Governor Cuomo and other governors. Aren't they going to be your competition at the end of the day? Do you even have a business, or is there, or are you potentially dead on arrival because you got to compete against the government?
So there are 350 million people in the United States, just to begin with, right? 350 million people. There are 26 million people, I think, over the last 3 to 4 weeks in the US that have applied for unemployment insurance. The United States needs to get back to work. The Canada needs to get back to work, but we have to protect the health of our system and our citizens and figure that out. The only way to resolve this and get it going is we have to have testing. I believe there is ample room. Again, we've listened to federal, state officials in the United States who have clearly said on CNN and other major channels is that government can't make this work on a testing basis. Private sector will need to help figure it out. So I believe that the total addressable market for this service in the United States is so enormous, keeping in mind that this is not a one-time test and done. Think of our phase 3. Businesses will not be able to operate with confidence unless they are able to demonstrate internally and then ultimately externally. And let me,
it's going to become a marketing tool, Steve, right? Come to George's place because we test everyone once every 2 weeks. And Steve's going to say, come to my place because I test my employees every week.
Yeah, so as an example, so I've got a vision. Let's just take an industry that we're familiar with, which is hospitality and hotels. I'm getting back to the concept of traveling as a consumer, and I see Hotel A has a banner that says, we test all employees weekly for COVID-19. Hotel B has nothing and can't answer the question when a guest calls in to try to book. It's my belief that businesses who actually will use this to help get their economy back. One, they need to keep their own employee base safe. 2, if they're customer facing, they need to keep the customers that they serve safe. 3, if they want to get customers to show up, they're going to have to demonstrate to those customers that they're actively doing something about it. And we don't know how long this will last, but this is going to be well into 2021, and it might be 2022. Yeah. And God forbid something else shows up, that has pandemic-like.
Don't even say it.
Right?
Don't even say it. But this alone is going to be at least another 9 to 12 months because until we can get vaccinated, this is going to have to take place.
Yeah, and we know a vaccine's not even going to be available for potentially 12 to 18 months. And even if then, it's how does it get into the hands of mass market? So then you have a distribution problem.
I guess at that point, we're jumping ahead here, but I'm just thinking aloud. Does that then become another business potentially down the road for Empower where you're deploying vaccinations because you got clinics and you've got this whole setup and you've already had the customers at ABC Widgets and you call back George, say, hey, George, we can come back, but instead of testing, we're going to vaccinate everybody for you.
Well, and we also, now imagine one of the things that we haven't talked about, but I've had it in the back of my mind since the get-go on this initiative is every single consumer/patient who comes to us has to register on our website. I anticipate we are going to be generating hundreds of thousands and potentially into the millions of email addresses and names and phone numbers that we have to obviously keep private through privacy requirements. But these are now active customers of ours that if additional services in the future, such as testing or such as the concept of a vaccine service and who knows what else it might be, I know that we are going to be building a large and valuable database of consumers as a byproduct of this service.
Which is why it's now, not now they see it, but it was always clear, but there's the extra double, triple, quadruple incentive to make sure your processes are so bulletproof that George says, hey, when I got to go back for another test, there's no question I'm going back to Empower. If I got to get vaccinated, I'm going back there because that's almost going to assure repeat business. One more pitfall that I want to potentially talk about, which is financing, the cash flow specifically. The more successful a company is, let's face it, there's a reason why we watch Shark Tank, right? Guy at ABC Widgets comes on and says, my biggest problem is I'm selling 100,000 widgets. Why is that a problem? Well, I got to pay for them up front, but I got to wait for Walmart to pay me 90 days later.
Yeah.
Can you potentially become a victim of your own success there as well in terms of cash flow?
Well, I think I'll make a very important statement here for all of your listeners. Everything that we're doing related to these services is COD. So we are paid up front. It is our intention to not offer payment terms to businesses in phase 3. The demand is so high, and you're right, we have to protect the cash flow. So we're cash flowing the wholesale purchase of the kits themselves. The labor is absorbed in our biweekly payroll.
It's already there anyways.
And we have third-party costs like PPE, marketing, things like that. But to the extent that it's absorbed through the cash flow cycle, meaning that, again, these first appointments, we're not out of pocket on any appointment because the appointment is paid for online in advance of even showing up.
So especially the businesses, so you go do 100 of George's employees at ABC Widgets, you don't have to worry about collecting 30 days later and George's gone out of business because of the coronavirus.
No.
You're getting all those paid a couple of days in advance. You're paid before you get to the door.
Absolutely. It's the only way that this is going to sustain itself. And frankly, I can be fairly firm on that because I know that the demand is so high. The other format that we have under the phase 3 BET program is a subscription program. So, there's going to be, a business might determine for themselves that due to the nature of their business, whatever it might be, their frequency of repeat testing is biweekly.
So your hotel example earlier that you brought up.
A perfect example.
Say, we want you back every 10 days.
Exactly. And so what we do then is we set up a subscription program with them. But again, this is advance pay. I'm just not going to be in the business of cash flowing this. There's too much risk associated with that now.
Sure, because the very nature of the testing is because businesses don't have the cash flow and they're not operating at full capacity. You can't take that receivable risk. And then find out that 50% of your customers don't have the cash flow.
Yeah, we're not taking the receivables risk. And so the early entrance for us, and again, why we want to pilot is very much about cash flow. Like I can't, we're not going to go and try to buy, 2 million kits right now and warehouse them and inventory them. We're going to phase into it. I've got a small purchase that's happening like as we speak. I've got another PO that goes later in the week where I'll get another 5,000 units ordered. Again, we'll put that into our supply chain and we're going to turn those over quickly. I mean, I have verbal orders in the tens of thousands right now from businesses. So, we know that the demand is there.
Can you start taking deposits? Would you actually start taking deposits or would it be too early to say, okay, George, if you want to be on the list, I know you, I like you, but you want me to test everyone at a GORCOM, you're going to have to send me a deposit.
Yeah, so we're going to do that in kind of two ways. One, we're going to do the consumer version where we'll open up phase 2 registration, get on the list, put a deposit down. You'll be at the beginning of the line and just build a base there. And then 2, we absolutely will start, and it might be, really toward the end of this week, we would start taking order requests and again, deposits from businesses because they want to be at the front of the line, at the front of the queue when our capacity starts to come online.
And this culminates in my last question. So thanks for dealing with the risk factors because look, client, friends, doesn't matter. I've got to ask you the questions that investors are thinking about at home. That's why I want to address whether you got a potential supply crunch, whether the government becomes your customer, whether you run into your competitor, whether you get a cash flow crunch. People have to know that, right? And I'm glad you. So now let's talk big picture. I know you can't make projections about. Phase 4 is the national rollout, which I'm going to assume is, and because we want to be short on time too, but I'm assuming that the national rollout is really going to be a B2B, at least to begin with, because it'd be hard to get to Bob and Mary and John and Joe in Minnesota and Texas and so on.
Yeah. So
but how big can this get? Like Steve,
you're right. You're right. So if you think how this scales, and if I thought long and hard about our phases and what was possible, what was realistic in a rollout. And the concept of nationwide, what does that really mean when there's 350 million Americans? So within our capability, transitioning phase 3 to phase 4 is a really natural widening of reach.
Right.
Because let's say that we are initiating phase 3 in Greater Phoenix because that's where our footprint is right now. How does that start to evolve out? Well, I have to create the deployment networks and the partner clinicians to be able to train appropriately. And we can centralize the service of call center, email correspondence, and website for registration. That part is easy for us to do. We do it today, every day, anyhow. But then it's just taking
at a level, by the way, I have to add, because there are going to be a lot of new people watching this, at a level that most companies, because I've seen it, aren't able to execute at. You don't just have a simple website with a form and a call a number. I mean, you've going back again to your extensive training, you've got this down to a science.
Yeah, we do. Listen, we are very strong at the operations layer. We have tremendous technology. We've got an amazing EMR system. We've got a spectacular telehealth system for telemedicine. We have a text message platform. We have an email campaign platform. We have a call center. And so we're using all of the technological methods to ensure that the patient experience is smooth, that it's comfortable, that people show up for their appointments because we use appointment reminders. All of these tools are assets that we already have in place. What we're doing, we're leveraging these assets with this COVID-19 product and service, and we're taking a measured and careful pilot to phase 2, to phase 3, to potentially phase 4 approach to this so that we don't trip. We work within our means. I'll be happy to work within our means. And if it scales in a manner that I believe that it can, then we're looking at, a quantum scale business that doesn't resemble anything to what we are right now.
Yeah, because I've been trying to kind of run the numbers in my head as we've been talking, and I don't think it'd be fair if I asked you if you had a number, and I don't think you'd be allowed to say a number.
It's too early. It's too early.
Yeah,
do
you think at some point you've modeled it out? You've modeled, I know you. If anyone's modeling all these out, phase 1, phase 2, and how it rolls over and rolls over and rolls over. Yeah. You think in the next phase 1 you've deployed. Phase 2 is going to be in May, which is not too far from now. Phase 3 is going to be in May. By then, do you think by June, after a month of operating all 3 phases, you'll be able to maybe present to the market a model for what you see?
Yeah, I think so. We'll have a much clearer idea of throughput. We'll have a much more clear idea of our supply chain, and do we end up having supply chain limitations or not, or is the supply that we need right now, nothing for our suppliers because they're making millions of units per month, and we're using, 25,000, or whatever the number might be. So
yeah, you're going to go way over 25,000 a month. That's for sure. That's for sure.
Yeah. Well, I would expect so, but because I know the demand already, even in one market, never mind, other markets. Yeah. So, we are optimistic, of course. I'm going to wait on the math. I know what our revenue structure looks like. I know what our cost structure looks like. So I know what our margin looks like. So what I can tell listeners out there is we are not gouging the marketplace in any form, but we're also operating a business where we represent shareholders, and we need to ensure that we're operating profitably. This model...
Yeah, because if you go under, then you're not serving anybody anyways if you're trying to run it too thin and be a charity, because you're not going to be able to afford it, and then people aren't going to get tested.
Correct. So I can tell you right now that we have a very comfortable, strong EBITDA model in our pricing model. And the other thing that I'll say is I'm not afraid to flex the model. If I find that our cost structures are increasing because the demand is so high, then I'll increase price accordingly. I'm not afraid to change and react based on the data that is presented to me. So, we're going to operate this, in a nice EBITDA fashion. Again, respecting the need for society to get access to this. But we're running a public company, and shareholders expect a return on investment. We believe this is a great use of our assets, and we have the capability to deliver it. Today was the start of phase one. It's live. And we're going to work hard every single day on behalf of patients and shareholders and deliver these results.
And look, last thing I'll say for everyone at home is this isn't just lip service. Empower is perfectly positioned to be able to do this because of the clinical foundation of the company to begin with. I could have George's CBD cannabis company. I could be a great company with great efficiencies. I'm able to procure, I'm able to sell. But if I don't have that structure, I'm lost, right? There's just no way to do it. And here's Empower. You have the clinics. You have the entire process necessary to administer an antibody testing program is what you already have. And 99% of other small cap companies, small cap cannabis, CBD related companies just don't have. So I'm, Steve, we've always had amazing interviews. I keep telling everyone you got to hear and watch Steve. He's not the promotional guy. He's the Six Sigma certified CEO under Jack Welch. This guy approaches it with military precision. And that's why we've been banging the table on Empower for so long. But now as I watch this come together, my mind starts to think, my goodness, you might be walking into the absolute perfect Forrest Gump style storm. When all the shrimping boats, you're the only shrimping boat that could do what had to be done. So I'm excited about what's possible. And I don't say that a lot, but I'm excited, and I think you are too.
Yeah, we are. We're thrilled. We're hard workers. We're very practical and pragmatic. But this is important work. This is life work. And so, it's a passion project for all of us as well. And I think we're onto something. And we've turned this around in a very short period of time to make this service available. And you can just imagine how many moving parts have to be coordinated to actually get to market with a new service and a new product offering. It's not easy, but I've got the team to do it. I've got the leadership on the ground at the clinic layer, and I'm just pleased to be able to continue to tell the investor community and our shareholders and the capital markets community to pay attention to us. Keep following. We've got a lot of interesting things in our arsenal, and we're starting to potentially reap the rewards of all the restructuring and hard work that we've done over the last 14 to 15 months.
Well, Steve, I'll let everyone have a sneak peek into a personal conversation between you and I, but when you and I first met through acquaintances, and someone says you need to meet Steve, he's walking into this firestorm at Empower Clinics. He's the guy who's going to be able to completely clean it up and move this company forward. That was in January last year. That was in January 2019. Could you have ever imagined, with the conversations we had, the meetings we had, the endless conversations, how are you going to do this? How are we going to do this? That 16 months later, you've positioned Empower to be the tip of the spear in terms of helping out America's people, America's businesses with something so critical to getting the country back up its feet. Even I didn't foresee that for you, but it doesn't surprise me at the same time. So, man, congratulations! Smile ear to ear. Be proud of what you've done in 16 months that most people can do in 16 years. And we can't wait to have you back on, I don't know, whenever you're ready to tell us how phase one and phase two and phase three is going. But thanks for being with us, Steve. And I hope everyone at home has loved watching and hearing you.
Thank you, George. Always appreciate the time. Thank you to your audience. And keep on watching, because there will be a lot of updates coming, because this is all moving so quickly for us.
You've been watching Steve McAuley. He's CEO at Empower Clinics. The company trades on the CSE under the stock symbol CBDT. Best symbol, can't forget that. For our friends in the US on the OTCQB under EPWCF, and of course for our friends in Europe on Frankfurt under 8EC. You're all at home. You've got a lot of time on your hands. Do your due diligence, especially now that you've seen the news come out, the market reaction, and watching this interview, or listen if you listen by podcast on Spotify or Google Podcasts, as to where this company is going. Start that due diligence. Start the due diligence by getting to Agoracom, punch in the company's name on Empower Clinics, get to the profile, read through that, watch a couple of other interviews, but make sure, like Steve said, you're watching this company because it is unbelievably well positioned under unfortunate circumstances of what's going on in the world. But hey, someone's got to be there to help save it, and Empower is doing that, and at the same time, potentially doing great things for their patient shareholders. Thanks for joining us, everybody. Reminding you all to stay safe, stay healthy, so you can all potentially find your next great small cap company in Empower Clinics. See you later.